Good morning, everyone. My name is Mary Catherine Massiangelo. I am the AVP Human Resources and York's Chief Human Resources Officer. I have the distinct pleasure of welcoming you to today's special York University Toronto Public Health COVID-19 outreach session, and I will be your moderator for today's session. Let's begin with our land acknowledgement. As this event is virtual, and we are not gathered in the same space, I recognize that this land acknowledgement might not be for the territory that you are currently on. We ask that if this is the case, you take the responsibility to acknowledge the traditional territory you are on and the current treaty holders. As a member of the York University community, I recognize that many Indigenous nations have long-standing relationships with the territories upon which York University campuses are located that precede the establishment of York University. York University acknowledges its presence on the traditional territory of many Indigenous nations. The area known as Takaranto has been caretaken by the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. The territory is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. I would like to thank and welcome everyone at York and at Toronto Public Health who came together to quickly plan and organize this joint information session. And of course, thank all of you in the audience who were able to join us this morning. As you may know, today is York University's Red and White Day. Once a year, the York community is invited to participate in festivities where we celebrate and recognize the people who continue to make the university a success, including our students, faculty, and staff. This year, we're asking the community to share your pride virtually by wearing red and white and by using one of the Red and White Day themed Zoom backgrounds like the one I have behind me. You can find these Zoom backgrounds by visiting redandwhite.info.yorku.ca. Before today's session begins, I would like to invite President Rhonda Lenton to turn on her camera and join us for some brief opening remarks.
Thank you so much, Mary Catherine. Good morning, everyone. Bonjour, bonjour. I would like to express my personal thanks to Marina and the Toronto Public Health Rapid Response Team for offering this unique opportunity for the York community to learn more about COVID-19, particularly given the recent rise in cases in Ontario and Toronto's return to a modified version of stage 2. From the outset of the pandemic, every decision that York has made has been guided by the health and safety of our community. This includes decisions that we've made about face coverings, protocol, and infrastructure changes, such as the installation of more hand sanitizing stations and plexiglass screens. And of course, this also includes our transition to remote learning, teaching, research, and work formats. More than 97% of our 3,500 undergraduate courses are being offered through online delivery for the 2021 academic year. As a result of these measures, cases on our campuses are low, and we want them to remain low. The university's Emergency Operations Center continues to be aligned with and guided by Toronto Public Health and also government guidelines. We are committed to doing our part to reduce the spread of COVID-19 and to keep our community as well as our loved ones safe and healthy. Mental health is an important part of our overall well-being. I do also want to mention that today is Red and White Day at York, as you've heard from Mary Catherine. And as many of you likely know, this is when the university community celebrates our spirit through more lighthearted activities and events, all of which are being offered remotely this year. I know that the pandemic has created additional stress for many community members. So I encourage you to maybe try and take a little bit of time to connect with colleagues and to participate in activities like how to make a bagel, trivia game, or even an exercise class. You can learn more at yourq.ca/redwhite. And more about mental health resources and services offered by the university at yourq.ca/mental health. Whether you are working from home right now or on campus, today's session is an opportunity to get the latest updates and have your questions answered directly by Toronto Public Health. Thank you once again to Marina and to TPH for today's session, and also the important work that you have been doing for our community and the city. Merci, miigwech.
Thank you, Rhonda. I would like to take a moment to review this morning's agenda. This session is scheduled for 90 minutes. It will be recorded and made available on our YU Better Together website for those who are not able to attend this morning. The information presented here is accurate as of today's presentation and may change rapidly depending on the course of this pandemic. Due to the rapidly changing nature of COVID-19, this recording will only be available on our website for the next 7 days. It will then be removed to deter the dissemination of out-of-date information. We encourage you to always check the City of Toronto's COVID-19 website for the most up-to-date and accurate information. And now, please join me in welcoming Marina Chestaya from the Toronto Public Health COVID-19 Outreach Rapid Response Team, who is leading this morning's presentation. In the first hour, Marina will deliver a presentation covering some of the following topics and more. COVID-19, how it spreads, symptoms, and up-to-date information. How to reduce the virus spread and stay safe. Choosing and wearing masks and face coverings safely. Making the right decisions about going out. Social stigma and discriminatory behaviors. COVID-19 testing information. Self-isolation. Finding the right support, such as government, health, mental health, and community services, as well as other available services and trusted sources of information. Following the presentation, I will rejoin Marina on screen for a question and answer session, where Marina will answer the pre-submitted questions collected over the last few days, and if time permits, additional questions submitted from the audience throughout the presentation. To submit a question, please use the Q&A feature within Zoom at any time during this presentation. We will do our best to address all questions submitted. However, due to time restraints, we may not be able to address all of them. With that, I'd like to turn it over to Marina to start the presentation.
Good morning, everybody. Thank you very much, Mary Catherine, and thank you very much, President Linton and everybody. Thank you for having me with you with this session today. I must say that I have a very special connection with York University because this is my alma mater. I did my grad school in York University, and now my daughter is a student of York University. So this is, talking today is my kind of getting back or hopefully giving back to the York community. This is my great pleasure. Let me share my screen and start the presentation. As Mary Catherine already mentioned, the topic of our presentation will be how to protect yourself, family, and the community. And especially for York University, I added some extra information regarding the guidance and policies, or some information specific for York University. I know all of us heard a lot by now about coronavirus and about COVID-19, but just a brief review of the information and not to content the information which you already received, just also to share where Toronto Public Health stands as of the point of today with the information on COVID-19. So generally, coronaviruses, as you know, is a big group of viruses, and normally they cause a mild illness. However, viruses which are spread to humans through the animals, they may cause much more severe symptoms of illness. Examples of this, you probably remember there was SARS, severe acute respiratory syndrome, or MERS, middle ear respiratory syndrome, which were in 2003 and 2012. This coronavirus we have now is another strain of coronavirus. Specific of this virus is that it spreads rapidly. It spreads through close contact. A lot of information is still not known. It's still evolving. So is the virus. So we're trying to be up to date and share this information for you. As of the day of today, how Toronto Public Health stands, we still agree with Health of Ontario that the most common how it spreads is through the close contact with an infected person when they cough, sneeze, or talk, meaning it spreads a respiratory infection, and first of all, it spreads through the droplets. The droplets, the particles can be larger and can drop to the ground or surfaces, or they can be smaller, then they're lighter and they can be suspended in the air. But still, we're talking about droplets. That's why we will talk about this later. The first logical thing to do is just to protect yourself with the mask, so to not to give the way of these droplets to spread to other people. As I said, viruses can land on the surfaces, but and survive on some material, like for example, plastic or metal. It can survive for up to 72 hours. However, it does not spread commonly or easily this way. And we will address some questions about the spread probably later. But again, mostly it spreads respiratory through the droplets in close contact. Most contagious are people when they're sick and during 48 hours before they show symptom. This is very important to know. That's why the rate of spread of COVID-19 specifically is so high, because people may not be aware that they are contagious. Because it's 48 hours before they have even symptoms, or some people even testing positive, they may not develop symptoms, but they're still contagious and they can spread the virus further. Some about aerosol questions, just to anticipate some questions about ventilation and aerosol transmission. There is some evidence that the lighter, smaller particles present kind of aerosol and are suspended in the air. How this mostly common but through the dental procedures or some surgical procedures. However, in the community settings, there is always airborne way is not a way how it's most commonly spread. Still, want to repeat, it's through the close contact. Talking about this, we still want to maintain good ventilation. We should watch the air filters in our cleaning systems. This is where open the windows, give the flow of the fresh air. And this is also the reason why outdoor activities are more recommended and considered more safe than indoor, where there's less ventilation and more chances for those particles to stay and spread. Here I just want to draw your attention to the COVID fact sheet about transmission, aerosol, and ventilation. This is a snapshot of the document which is available on Toronto Public Health website. if you're interested about specific of aerosol transmission, all the details on ventilation, maintenance, please refer to this document, and the link is provided here. So it's very, very helpful information, I hope you may find. This is about symptoms. I know you probably saw those posters on grocery stores, and I'm sure you have them in York University. Why we need this constant reminder about symptoms. And the symptoms you apparently can see is fever, cough, difficulty breathing, sore throat, loss of taste of smell, runny nose, nausea, like this. Children may have slightly different symptoms, but why is it important for us to know those symptoms? Because we don't want to be extra paranoid or paying too much attention to this. We just need to be aware. If we have any of those symptoms, first thing we should remember, we should self-isolate. We should consider getting tested, or just wait for the period of time if you don't want to get tested for some reason. But what we want to do instantly, if you have any of those symptoms, try not to spread it to your close ones, to your friends, and to the community. This way we'll be monitoring those symptoms, and this will prevent us from spread COVID further. This, as I mentioned, if you have children, or if you're working with children and they have slightly different symptoms, it's a good idea to call Telehealth Ontario, call your primary healthcare provider, or call the COVID hotline. But if it's for anybody who has severe symptoms, or for the younger children, it's a good idea to call the hotline or go to emergency if it's really severe symptoms they develop. You probably also heard this information that first we're talking about vulnerable populations. Who is vulnerable? Because if you look at the data for cases for COVID-19, ironically, it's not among the senior people how COVID will mostly spread, but among the young people. But young people, they have a better immune system, and they tended to develop much milder symptoms. They may not be even aware. However, older adults over 60, they may have more chances to develop severe symptoms or get hospitalized. Also, in the most vulnerable who are prone to develop severe symptoms of this illness are people with weakened immune system, having, for example, cancer treatment, or people having autoimmune disorder or with some chronic health condition like asthma, diabetes, or heart disease. Talking about asthma, I received multiple questions on this from people who suffer from chronic asthma, and being asthmatic myself my whole life, I'm just sharing this, that you have to be mindful of the symptoms. You have to watch the symptoms of asthma, which would be different from you have experienced before. As an asthma person, you have your inhaler with you probably, but if you noticed some other symptoms of COVID as well, or if you noticed you feel somehow really different, it's a good idea, take action, self-isolate, think what's happening, watch your symptoms, self-monitor. Now, if we have more questions on the spread, on the symptoms, we'll definitely address them after the presentation. Now, I just want to talk a little about the issue of stigma. If you see this question, which sometimes often being asked in the community, which areas are better, which areas are more affected, where should I go, where should I not go? And especially York University as a very multicultural, multilingual community, multi-ethnic, and a community coming from different places where students come from. This is very important to spread the word that we should not help in any way to support this kind of stigmatizing, because certain neighborhoods or certain ethnicities are not the reason, are not the basis for the spread of COVID-19. We should be clear on this. People living in certain neighborhoods, which because all data is available on Toronto Public Health website, certain neighborhoods do have a higher rate of cases, but it does not mean that people got this infection in those neighborhoods, because mostly people who live in those neighborhoods, they travel to work, and through travel, they may get it anywhere else in Toronto or outside in Toronto rather than where they live. In the apartment buildings or in their condos. The same apply to ethnicities. No ethnic background is a prerequisite or is a condition of developing COVID easier. We should be clear on this. And actually, Toronto Public Health has a very recent campaign, anti-stigmatizing, which is called Campaign to East Asian Racism. It started as of October 13, and this is on toronto.ca anti-East Asian racism. If you want information how you can support this campaign or how you can start a campaign supporting other ethnicities who are becoming vulnerable to the stigmatizing like this, please go to this website, go to Toronto Twitter, and they have resources how you can support those process for anti-stigmatizing. How we can reduce the virus spread, how we can really stop it, unlike stigmatizing somebody, which will be completely counterproductive. The measures how to reduce the virus spread are also posted everywhere. They seem to be very trivial. However, these are the most effective measures known so far. This is wearing a mask. We call them 3W. Wear your mask, wash your hands, and watch your distance. For people who can do this, they should be considering themselves privileged. They can watch their distance, they can wash their hands, and they can wear the mask and put the mask on easily. Unlike, unfortunately, a lot of vulnerable population who those simple things are not so easy for them. For example, people who are blind or people who have hearing problems or who are deaf. It's all providing challenges, extra challenges for them. We should be mindful of those people. And for those students who have those challenges in York University, I will refer you to the resources which are available, extra resources which are available for support for these vulnerable populations. About the mask, I have actually several slides about the mask. First, because again, this is the most effective up-to-date measure to prevent spread of COVID. First thing to mention here that when wearing the mask, what we're doing first, we're protecting not so much ourselves, but putting the mask on, we're protecting the other person. And when the other person puts the mask on, they protect me. That's how it works. But putting the mask on, we are containing the droplets, the particles of potentially loaded with infection. We're containing them to ourselves. So this picture actually gives you a clear understanding. So if everybody ideally wearing a mask, we're limiting this chance of spreading infection to each other. And as you know, there has been several bylaws, so it's not even an option now in certain places to wear a mask indoors. But here you all aware, I'm sure, about those mask bylaws. It's in the grocery stores and in York University and in other places, even in apartment buildings. Now, as of October 3rd, in public transit or taking the share ride, where everywhere where you in chances of closer contact or even not so close, just as a measure of protection, we should be wearing masks. Here, it's important to mention that there are still categories of people who are exempt from wearing masks, who cannot wear a mask for different reasons. These are children under 2 or people with special needs, which is very hard to explain to them why they should wear the mask. It's a lot of struggles for them. People with certain disabilities. There are different kind of reasons why a person cannot wear a mask. What to do here? We need to be mindful of those people. We should respect. Must be a reason. We cannot ask them for, in the grocery stores, we cannot ask them for the background of the exemption, for some document to prove. But as an organization, it may be in your policy, you may protect the health and safety of other members, and then you may suggest, well, you may refuse actually service to a person without a mask. You cannot enforce anybody to wear a mask, but you can refuse the service, but it should be written in your policy, and you should probably provide some alternatives how this person can receive the services, not violating their human rights, and at the same time, not putting in danger other members of the community. About choosing the right mask, again, it's a very probably basic information. However, just a few reminders, mask should be made of at least 2 layers. Logically, the more layers there in the mask, the better is protection, but you're also thinking how you can breathe. And your mask should be comfortable. The best mask for you is the one you can wear comfortably. Ideally, you put in the mask, you wash in your hands, you put in your mask on, and you do not take it away until you have to take it away. Ideally, you should not put your mask back, especially when your hands are dirty. You should take the mask off through the hands, through the outer side, and put it either in a sealed plastic bag, or if you cannot wash it right away, or just put it in the laundry, or just put it in, wash it right away with hot water and soap, and dry it with the dryer. This way, the infection, the virus particles can be killed through the washing and laundering. Another important thing to know is you can see on this slide what is the better mask. The better mask is which you can breathe and which you can wear comfortably. Things to be aware of about the face shield. It's a very, very common misconception that putting a face shield can be a substitution for the mask. It cannot be substitution because you prevent the front load of particles, of potentially contaminated particles. But when you yourself breathing, you're breathing your air out, and this way the virus can spread from the sides. The same applies to you when you breathe in, whichever is in the behind close contact near you, that maybe contaminated particles can go in through the sides. That's why if you're considering wearing a face shield, you should wear a mask anyway. The same applies to the clear plastic mask, which is on the right side. These are measures which have been approved by Health Canada for people who are deaf, who need lip reading, who rely on this information. This is like a measure to communicate to these people, to accommodate to the people who need to see your lips, to need to see your face. However, then you should be very aware that you should be at a distance from them, at least 2 meters, but further as possible, because this face shield will not be protecting you or the person you're communicating with. The same applies to the masks with exhaust valve. I know it's been very popular on the market, and people even they cost more, and people were willing to pay extra for those fancy kind of masks. However, those exhaust valves they make it easier for you to breathe in, but at the same time, they when you're breathing out, the particles can go out and contaminated droplets can travel further. So these are all not recommended. And again, the best mark is a cotton washable mask from several layers, which is comfortable for you to wear. Another effective measure to stop the spread, which is recommended by the government, by Toronto Public Health as well, is downloading the COVID Alert app. It's been approved by the Human Rights Committee. It does not reveal your identity or your location. It complies with the privacy regulations. It works on a Bluetooth technology, which allows phones with this application to communicate between each other. So once one of the people having this application become tested positive with COVID, the app automatically notifies people who have been closer than 15 for the longer than 15 minutes and closer for 2 meters with this person who get tested positive. This way, people can action. People receiving this notification, it does not mean they necessarily become sick, but what they need to do that they are close contacts, they need self-isolate for 14 days. And we'll talk about self-isolation in a couple of more slides. Just because especially lots of students or lots of people who working in different neighborhoods, they unfortunately still have to travel and take public transit. Travel is not recommended, but it cannot be prohibited because people do have essential reasons for travel. So when taking public transit, I have been receiving many questions. Is it safe to go on a bus, especially if it's a rush hour? Of course, this is your decision to make. I would be concerned going on a bus, especially in the rush hour, but if there is no other way, you have to go. You just have to take extra measures of precaution. Everybody should be wearing a mask. And as I said, as of October 3rd, everybody is required to wear a mask on the public transit. You should disinfect and sanitize your hands. And on their side, the public transportation are taking measures. They're complying with their guidance and policies for sanitizing, cleaning, for ventilating the air with all the regulations. So on both sides, those safety measures should be maintained. Now let's get to the topic of testing. If somebody get notification by the app, if somebody got symptoms of COVID, or people belonging to some category specified by the Ministry of Health or Ministry of Long-Term Care, it's a very good idea. It's very recommended to go and get tested. Sometimes employers require people to go get tested, so to feel the other members of their company more protected. Testing information is available on Toronto Public Health website, where to find the location. Also, if the person is unsure if they should get tested, it's a very good idea. It's also said on Toronto Public Health website. They can just call either their primary care provider or Telehealth Ontario or Toronto Public Health hotline. These are three numbers I'll be repeating again and again. So these are three numbers. You should write it and put it on your fridge probably. If you're not sure if you have to go and get tested, it's a good idea to call those numbers and verify. Also, there is self-assessment, ministry self-assessment, and Toronto Public Health has this button on their website where you can click, which takes you for self-assessment, which helps you to make decision regarding getting tested. And again, the locations you can find on Toronto Public Health website. There are now there is option of getting tested in the pharmacies. In the pharmacies, you're eligible for testing if you do not have symptoms. As of October 6th, you need to make everywhere you're going to go for testing, you need to call and make appointment. This measure has been taken to eliminate longer waiting periods so they can plan better how many people they can see. Another option for testing will be pop-up testing. Pop-up testing is when the mobile clinic, testing clinic comes to the community directly. As a Toronto Public Health, this is, let me point out, this is organized by the provincial authorities. Toronto Public Health have been participating in those pop-up mobile testing, and they're happening now through the multiple neighborhoods in the city. To find information on the nearest location of a pop-up testing or the coming pop-up test, the best would be for you to go to Toronto Public Health Twitter, and the most recent pop-up testing sites, they post it right on their Twitter. So just following Toronto Public Health Twitter is a very good idea to get up-to-date information as well. Pop-up testing is a very flexible option because you don't need to have an appointment. You can just come to this clinic and get tested. As a university, you also have an option to organize mobile testing at your location. I will give you the reference where you can go. This is in the guidance for the post-secondary universities, post-secondary institution, colleges and universities, the contact how to organize the pop-up testing in your community. What happens after testing? Easiest way to answer this question to yourself, just follow the directions which are given to you at the moment of testing. Because when a person shows up for the testing, in any case, he's going to be notified if it is positive, what's going to happen, if it is negative, what's going to happen, and also what does it mean if it tests positive or if it tests negative. Because all the outcomes of the testing, they may be very, very confusing sometimes. If a person, for example, tests negative, it doesn't mean that he may not be contagious because or he doesn't have COVID. It says that he doesn't have enough COVID on the moment of testing. But the symptoms, as we know, may develop within 14 days. That's why the self-isolation period was still defined as 14 days. And if a person tests positive, they need self-isolate. That's a very important measure to protect our whole community and stop the spread is self-isolation, which is now the law. Again, just to repeat, who should self-isolate? It's people who have been tested positive by the testing site, people who have COVID-19 symptoms, people who have been in close contact with someone who has symptoms or has COVID, or people who returned from anywhere from outside of Canada within 14 days. Now, the legislation have been just recently changed actually regarding the how many days you have to self-isolate. For people who has been exposed to COVID, who are the contacts, who are the close contacts, this is 14 days as of the day after the last contact. People who have COVID-19 symptoms need to self-isolate for 10 days after their symptoms started. After 10 days, if they have no fever or if their symptoms have been improved, at least for 24 hours, they may stop self-isolating. And finally, people who have severe symptoms and had to go to hospital or have been hospitalized or have been severe are defined if people have been hospitalized or when they received critical and been in a critical care unit, all those severe cases, then they need to self-isolate for 20 days. So the term has been different now. Again, 14 days for all the contacts, 10 days for people with symptoms, and 20 days for people who have severe symptoms. When self-isolating, this is a very challenging time, and this time people need extra support. What they need to do, of course, they need to stay home. They need to keep distance from others in your home. Wear a mask. Again, we're trying just to be logical here and not to spread the virus to our uh, close ones. Do not have visitors. Wash your hands. Avoid sharing and monitor your symptoms. If at any point you start developing severe symptoms, then you need to call 911 for the severe symptoms. Good idea before taking any critical measures, you can call telehealth if you have questions and you think it's not a severe symptom, you need to go to emergency right away. You can call Toronto Public Health Hotline and you can call Telehealth Ontario. Also, it became very challenging for some people to self-isolate for various reasons. There's been a partner violence, or there's just they have a busy household and they cannot self-isolate safely. As of September 12th, Toronto Public Health opened Toronto Voluntarily Isolation Center, where people can isolate safely. To find more about this center, how to get this information, you can call COVID-19 hotline with this number. And again, to address, this is a very good resource, actually, what you see on your screen now. And apparently not many people are aware of this support resource, which is so simple, calling 211. 211 is the free service which connects you with all the government services, all the health services, community services, social services. Basically, what I've been telling clients in the community, whichever support you feel you need, if you self-isolating especially, or just during the COVID, if you get question and you feel helpless, you know you need the answer to this question, just don't struggle, just call 211. This is very easy. You can use text, live chat, email, or you can search online, as you can tell, so multiple ways. But for most people, sometimes it's very easier and faster just to call 211. They have operators who speak multiple languages, so they don't even have to speak English, which may be especially applicable for international students, for example. So this would be good information to share with them, so they can call 211 and they will either give them information where they need to call, or sometimes they connect people directly with the service providers in the community. And we're partnering with multiple organizations, and the more organizations are joining, the more nonprofit organizations or the more community organizations are joining, this information is supplied, submitted to 211, and this way the database is growing, and it's a very, very efficient way just to have all this support information in one point of access. For example, just a brief example, people wearing a mask and they say they're running out of masks. There are community organizations who have volunteers who making those masks, and they giving it for free to whoever community members are in need. So just by calling 211, they may connect you to one of those organizations to receive your free cloth mask. Another very important source of support, especially at this time, is the mental health support. I know President Linton already mentioned how much York University is doing to address those issues of mental health. And another point of access to find proper resources for mental health support, again, is just calling 211, because they can connect you also with specialized mental health support, not just in general, but they may be specializing mental health support for ethnic organizations, for different religious organizations, for different special needs, or clients with disabilities. So all kind of mental health support are very geared towards specific needs in the community. Again, easiest way, just call 211 to get connected to these resources. Briefly on intimate partner violence, this issue should be taken very seriously. 211 is the one to help, and it may be also somehow spread. The word may be spread about this, that this is not okay, not something to tolerate through your media or through your policies. Now, I just want to jump to the documents which would be probably mostly applicable for post-secondary schools like York University, and several documents to mention. First of all, I'm sure you all aware how to find information on Toronto Public Health website, but if it's not so apparent, if you go to toronto.ca COVID-19 reopening, recovery, and rebuild. I'm just reading the trace, which is you can see on your screen as well. So this is big tab, reopening, recovery, and rebuild. Under this section, you can find reopening guidance for businesses and specifically reopening guidance for post-secondary school. This is just how to get to those documents. And the most applicable documents, which I'm sure you're aware of, just to repeat where you can find more answers for the potential questions, is the guidance for post-secondary institutions, COVID-19 prevention checklist, which is done in the form of checklist. It's a good idea just to know what if you're doing it or if you're not doing it. There is a huge collection of resources for post-secondary schools. There is COVID-19 decision guide for post-secondary institutions and planning guide for colleges and universities. And I also provide you the link here how you can access this information. This is how you can download it in PDF or read it on the website. This is the general guidance, just to mention a few, what guidance for post-secondary institutions specifies for universities. In terms of maintenance of general health and well-being and safety on the campuses or in the university in general, you should support and encourage hand hygiene, which I know you're already doing. Practice physical distancing, you are in face mask and coverings, screening staff and students for symptoms. There should be a special and attendance reporting practices for staff and students and visitors. It's specified in this document how to report cases and outbreaks to Toronto Public Health, and also questions like maintenance of ventilation and air conditioning systems. All this is very detailed. It's a 15 pages guidance document, which has mostly providing information or refers to the additional links or resources where to look for more information. Again, also in this document, there is a section providing services to students and staff. And I know this will probably be mostly applicable for those of you who work in person with the students, who still at least partially, do not conduct their classes virtually, but still have deliver in-person teaching. And also for the essential workers of York University or administrative staff who still have to come to the campus and have a physical presence. So again, I would refer you in general to look at this document for more answers, but they specify what should be done in the classroom, for example, again, just implementing physical distancing, following the IPAC measures, which should be in York, and I know it's in the York policy already. If possible, open outside doors and windows to increase the air circulation in the area. You should discourage or remind the students not to share any personal equipment or supplies, and ideally there should be equipment allocated to each student individually, which will be cleaned, of course, afterwards, but which will eliminate the sharing and potential spread this way. There is a health and physical education section. There are multiple sections. I'm just mentioning just a few. Like, for example, gymnasium should only be used when physical distancing measures can be followed. There are specified sections for libraries or study spaces and other communal spaces. For example, it's recommended to either close or limit the access to study spaces, and discourage in general students from remaining on campus unnecessarily. Pertaining workplace health and safety, employers must have written measures and procedures for staff, including for IPAC. This document, again, I'm just citing brief sections of it, and you can read more in the guidance here. Review Ontario COVID-19 and workplace health and safety for information on where employers can learn about their responsibilities and how to protect workers at work. And there is health and safety protection for information on workplace health and safety. If you still need additional information, you refer to Ministry of Labor, Training, Health and Safety. And mental health, I know the President Linton has already mentioned it's being taken care of, it's being addressed, so I would not spend much time on this. Another good document, which I just want to point your attention, is resources for post-secondary schools. First of all, the first document, the guidance, at the end of the guidance, there is page-long links, a list of links which you can follow for information on various topic if you have questions. Another collection of resources is presented here, so you can go on Toronto Public Health website and download it. If you want, after presentation, I can send you the PDF if it will be necessary. Again, it specifies the resource, the link where you can find it, and the target audience who it will be applicable to. So I hope this collection of resources may be very helpful. If you still have more, I'm just watching the time, how much time I have left. So I just to run through the presentation. Would you have more questions on the York or university specific section? We'll probably get to it after my presentation during the Q&A section. For those of you who have children, many people are asking this, children who are in school or children who are in daycare. Just briefly, I would just share that there is a special team in Toronto Public Health, public health nurses. There's been 70 nurses assigned to different elementary and high school, and they are the main contact to answer the parents' questions, to work with administration of the school, to address all the concerns or issues right on the spot. On Toronto Public Health website, there is a detailed link for parents and caregivers, specifically for schools, answering most of the questions and giving links where they can find even specific nurse contact for their child school they can get in touch with to find more information on their specific school and applicable for their children. And also for parents, there is a good collection of resources, including these infographics. So if you follow the Toronto Public Health website for the parents' resources, they also give a collection of resources for parents and caregivers. Because we're approaching in a couple of days favorite holiday of many children and children not so long time ago, their parents. Just a couple of words about Halloween. This year I heard, oh, Halloween has been canceled. No, Toronto Public Health did not cancel Halloween this year. However, we just please ask everybody to stay safe and to promote safe ways of celebrating Halloween. For example, substituting dress up is great. We're recommending people to dress up. We encourage this. But instead of going out and gathering, you can do the virtual parties. You can just do crafts with your children, with your friends. And that's why Toronto Public Health have on their website a whole section on Halloween. It's again under recovery, recommendations for people and general public tab. If you go there, they have beautiful ideas on how to celebrate the Halloween safely. Last but not least, I would like to mention how we should all be aware of the COVID scams, because unfortunately there are many people who taking advantage of those time, especially of those most vulnerable who, like seniors or people who do not speak language fluently and whose English is not the first language, and they may call them, they may try to get their private information. That's why we should spread the word to be very aware that any claims from Canada Revenue Agency, so any urgent request of payment or any way of getting their identity information, their date of birth, their social insurance number, any private information, it should not be disclosed to anybody else that you know is a trusted source, or it's your personal healthcare provider. This is your friend, so these are people you know, or this is the agency who you really know. And trusted sources of information, not only for scams, but in general, there's been multiple information on COVID everywhere in the news, on social media. It would always be recommended to go to the trusted sources of information, like Toronto Public Health, Ontario Health. So you can call all this Telehealth Ontario, this is the number, or Government of Canada, or as I mentioned, your healthcare provider. So it's just a few. It's very clear, not many things to remember, but please be very careful and especially spreading the unconfirmed information. And I think I'm done 3 minutes earlier. I will have 3 minutes more for answering the questions. So again, just to repeat this phone number to contact Toronto Public Health, or emailing publichealth@toronto.ca for the questions you have. And toronto.ca website, on every page, you will see on your right the tab with contact information, which is specified for even for each case, when you need to call what number, when to call Toronto Public Health Hotline or to call Telehealth Ontario. And thank you very much. I'll stop sharing my screen at this point and rejoin you.
Thank you very much, Marina, for that very informative and relevant presentation. As mentioned earlier, we will now like to open up the floor to our question and answer session. Questions have been collected previously via a mock form that was circulated to everyone earlier this week. However, if time permits, we will also be addressing questions that have been submitted during this presentation. For those joining via Zoom, the Q&A function is still available to submit questions. Please note, due to limited time, we may not have the ability to get to all questions. Let's begin. Our first question from the audience. How often should you be changing your mask?
Thank you very much for starting with this question. Because ideally, you should change your mask as long as you have taken the one you're wearing. That should be the ideal, to answer your question. But because if you think of it, if you already took it off, and we recommend, I just want to repeat how to take the mask off. So you're going by the ends, by the ear loops, you're taking it off, and you're taking it from outside, and then you're putting it in a plastic bag. So if you try to put it on back again, if you think about it, all the potentially contaminated particles which collected on the outside, they can get to the inside. So when you put it in back on, you exposing yourself. So that's why ideally that's what you should do. Taking it off, putting in a Ziploc plastic bag and putting it, and when you need to put another mask, you put another clean mask. Unfortunately, this is not the case with many people we know. So, but that's the ideal way. And if you can, you should wash it right away in the laundry.
Thank you, Marina. Another question. Can you get exposed to coronavirus from secondhand cigarette or vaping on the street?
Vaping is not spread of the virus on its own, so it's not the vaping fume. However, again, we should remember that, as I mentioned, there are smaller particles. So if the person exhales the vape, if they, especially after vaping, they may cough or they may sneeze off the smoke, then there is greater chance of those particles to travel. So to protect yourself from this, first natural thing is you being 2 meters or more. So this is your first response to this. If you're 2 meters from somebody, you're already more protected than if you're closer. Another thing, if you just see somebody smoking, and so again, distancing and wearing a mask is your best protection for yourself. But smoke on its own, it's not the spread of the virus. Also, if it's not happening outside, if it's happening inside, where, as we said already, the particles can stay, be suspended in the air longer, it depends on the ventilation. That's why we need to maintain good ventilation. For example, smoking rooms, allocated smoking areas, we need to address those and to maintain the ventilation in the building as much as we can.
Thank you. I'm going to refer to a pre-submitted question for you, Maria. Could you provide any recommendations during this winter, especially for households with toddlers and small children?
Yes, I was trying to talk about this in the presentation already. Because, first of all, I would just want for everybody with children, that's how we've been raised. We try to be outside as most as possible, because being outside, being on fresh air, even if it's winter, you would just dress warm and just go outside. And now, even for the parents, for the school children, and for the teachers at school, it is recommended to have as much outdoor activities as possible and to try to bring their classroom outside as much as possible, because everything outside is considered to be safer than being inside. But still, we need to dress warm, because if it's winter, for sure. Another question to address here is mittens or gloves, because when it gets colder and we put the gloves or mittens on, this is extra thing to think about to wash them. because there will be chances, so they will be touching the surfaces, not with their hands now, but with their gloves and mittens, which is you coming home, not only washing your hands, but you will be washing your mask if you are wearing, and you'll be washing your gloves and mittens and putting them in the dryer or putting them just on a radiator to get it warm and dry to kill the potential bacteria. This will be another thing to remember. And generally, I would just refer parents to this again, to this great collection of resources for parents, which is under, repeat again, reopening for general public, click schools, open the parents tab, great collection of resources. And if you have more questions, again, call the hotline of public health.
Excellent. Thank you, Marina, for the very valuable resources. We have another pre-submitted question. Can COVID-19 virus permeate through the eyes? If it can, why is public health not mandating the use of face shields with or without masks?
Thank you very much. This is a very good question because ocular transmission, as per the Ontario Health website, how it spreads, ocular transmission is a valid transmission. It happens. However, it's been a minimal amount of cases. It's not studied yet, but again, everybody repeats on the Health Canada, Health Ontario, and Toronto Public Health website, the most common way of transmission is a close contact with the contaminated person. This is for the respiratory way. But to address those in the high risk context, that's why people recommended to wear a face shield and a mask, but never wearing a face. That's why is also why Toronto Public Health is not recommending shields, because in most cases, if you just less than 15-minute contact, you don't need them. We're talking about longer close contact, but and people can confuse wearing a shield and not putting a mask. Then this is the reason, because we should be putting the mask on first of all. In certain circumstances, in the high risk context, when you need, for example, and this is also mentioned in multiple guidance documents, when you work exposed to blood, when you're working in the long-term care, when you're on placement in some high risk context, then they should wear mask, they should wear full PPE, how they say. They should wear a mask, they should wear a face shield, gloves, and sometimes gown. That's all PPE, full PPE that should be wearing. Hope I answered your question.
Yes, you did. Thank you so much. We have an audience question now, Marina. Does the COVID Alert app automatically know the person has been tested positive, or is it still up to the individual to punch in a code to confirm that they have been tested positive?
I think it's automatically. Maybe there are multiple versions, but ideally that's the whole idea. So the app notifies automatically the user on another side. And for more information, for all the technical details, again, because it's not much time, we can go in the technicalities of Bluetooth technology, of programming, of downloading the app. I will just refer, because there is a big section on this on Toronto website. You can just go and get this information all there.
Thank you. I wonder if we could revisit what you were saying around public transportation. We have a question from our audience that would like to know, what is the best way for someone who's symptomatic to go and get tested if they don't own a car, given concerns perhaps about transportation?
It's a very good question and a very complicated question. What should you do, right? Ideally, the person should not take public transit. transit, they should, I think it's even written, if I'm not mistaken, on the Getting Around tab on Toronto Public Health website. They should probably call there are options like calling the taxi or calling the Uber or getting a ride, but they should notify the person that they are getting to get tested, and they should wear as much protection, because if you know, in the taxis they have been installed the plexiglass dividers. So ideally, person should be under the plexiglass divider just to protect the driver. Or also, you can call the hotline, Toronto Public Health, or the assessment center, and ask them what you can do in these circumstances. How is it safer for the public for you to travel if you cannot get a ride to the location?
Thank you. We have another audience question. How long should someone self-isolate if they think they may have come in contact with someone?
To be cautious, if they we have to specify if they think they should come. If they consider themselves a close contact. So close contact is a person who has been in contact with the positive case for closer than 2 meters, longer than 15 minutes. So that's the official definition of the close contact. But if they consider themselves close contact, they should self-isolate for 14 days.
All right, thank you. If someone's coming back from a different country, Marina, they have to isolate for 14 days. If they do not have symptoms for the first 7 days, they continue to isolate for 14 days, or can they stop?
No, they should self-isolate for 14 days. Thank you very much for specifying, because 14 days is the period when infection can develop, when the disease can develop. It's how long it can be in the body, and you may not even have symptoms. But after 14 days, if they do not have symptoms after 14 days, then they considered clear. But that's why this, as for now, it's official government of Canada requirement. If you travel, you should self-isolate for 14 days.
Okay, thank you. Another question around wearing of masks. Why are masks mandatory indoors if I'm physically distancing?
Thank you. This is for apparent reasons we already discussed probably in the presentation, because again, we're talking about the smaller particles, which can be suspended in the air, and depending on the ventilation in the room, because inside sometimes it's impossible to completely clear the whole air. That's why we're trying to distance, but still we need to wear a mask. So we'll be extra protected this way, right? Because everything which is inside, just again to remember, everything is inside is still less ventilation, less fresh air. It's considered less safe than outside, where it's more ventilation, when there everything can be cleared more quickly and more efficiently.
Thanks, Marina. And of course, at York, we follow this practice as an additional precautionary measure because they're most effective when used together, the distancing and wearing of masks. I'll move on to another audience question. Should grocery and other products purchased online or in person be sanitized? If so, in which way?
When the COVID started, we, and personally myself, I've been using tons of wiping cloths and sanitizers, and was going after every single detail in fruit and vegetable just to be extra, extra cautious. But now we're just finding out that it's not, the virus does not spread through the surfaces this easily. It may, but it may not, it does not spread this easily. So just following common sense sanitizing and cleaning is sufficient. Also, please do not, and there is also direction on cleaning and sanitizing in the reduce the virus spread section on the website. I'll be trying to refer as much as possible to the source, because if you, after this presentation, if you still have questions, you will know where to go for answers easily. Yeah, and I just want to repeat that vegetables and fruits, when people started applying those sanitizers on them, there have been even cases of poisoning. So that's why fruits, vegetables, greens, they should be washed with water. Again, water is the best solution to clean any kind of dirt, bacteria, even virus, because we're washing our hands, right? We're trying to use sanitizers as when we cannot wash something. So this would be the case. And this will apply even to our hands. So first idea for you to will be to wash, and if you cannot, use sanitize. But the bags, the grocery shopping, generally they can, again, if we're talking about normal, common sense community setting, not long-term care or not some kind of extreme environments, we do not need to sanitize the grocery bags and shopping thing.
Thank you, Marina. Your common sense recommendations are very helpful. Can COVID-19 testing substitute for self-isolation after returning to Canada from overseas?
No, in no way. No, thank you. The answer is clearly no, because as we said, testing is valid only on the moment of testing. If the person just returned from the country, they may not develop enough bodies in their blood when they're doing the test to identify the virus, but they may develop them during the 14 days period. So that's why they should still self-isolate for 14 days.
Thank you. Marina, earlier you spoke about nurses in our schools. Are public health nurses assigned to private schools as well?
Good question. Honestly, I will have to get back to you with this if you want, but you can call the hotline if you want sooner. Uh, I I am hesitant to say either way, yes or no, because I do not dispose this exact information. This is how it's called. It's called School Liaison Team. It is a special team which has been introduced and working very hard in Toronto Public Health. So this would be question to them. If you want, I can find out and get back to you on this for private school.
Thank you. We have another question from our audience. It appears to have a few parts. At York University, we have theater courses which have productions and shows as part of the curriculum. Student actors on stage wear a face visor and mask while rehearsing if they cannot maintain 6-foot distancing. That's the first question. The second question, Marina, is should actors and crew not exceed 10 persons while in rehearsals being in an educational setting indoors, or can we exceed that occupancy if the venue is large enough?
Thank you. I'll just break down the question into several parts. Talking about theater, first thing which comes to my mind about exact activities being involved in the production. For example, as we already mentioned, and it's also specified in the guidance for universities and colleges, for post-secondary institutions, such activities as singing, for example, or shouting or loud speaking should be eliminated. They cannot, because these are not considered safe. So that's what came to my mind talking about theatrical productions. I know this may be quite challenging for some productions, but that's kind of a guidance to follow. uh, Wearing visor and mask. I'm not so again, we were talking about the mask. Visor, as I believe, specified as a high risk when you using with some contaminated blood. So I did not see mentioning of the visor on top of the mask in the normal context of normal educational process. As for the amount of people to be in the room, you're correct. This is 10 people inside and 25 outside. That's the legislation we have. I know it used to be uh, capacity of the room. There are also capacity of the room norms, which are very specific for different kinds of businesses. For example, in the grocery stores or in some stores, you can see this capacity is 40 people, right? So, which is inside, for example, for the grocery store. It depends on the room. It needs to be double checked specific on the case, on the situation, because I do not dispose information of the size of your room. I would not be in charge of authorizing you. I don't want to give you wrong information based on your specific circumstances. So I would refer you to follow the guidance or the other legislative documents which would be complied with the stage of reopening, which will be provincial documents as well. That's why I provided this collection of resources, which clearly outlines specific questions while planning educational process by educational institution. While planning this or this activity, they can be addressed to specific even phone number or document to verify exact information.
Thank you. Another question from our audience. Are the resources at Toronto Public Health available for residents of other regions?
Absolutely. Absolutely, especially which are applicable pertaining general virus spread, infographics. We're happy to share those resources. Again, its website can be accessed from all Canada and abroad, so it's free. There are infographics, there are legislation documents, all collection of resources. The only problem will be time needed, because there is so much information that you need time to go through multiple tabs, and we have only one screen. Right? That's why I was even thinking having a book or catalog, like all old long days in the history, we would have a catalog which you have a single point of access, you can skip it faster. But with the website, you have only one screen, so you have to dig in, open every tab and go through the information to find. Another easy way to find the infographics, for example, which I find very efficient, like getting around for resources for parents. Infographics are wonderful. Easiest way to find the infographic, you would be surprised. Go on Toronto Public Health Twitter.
Excellent.
Not to go through the tabs, go to Twitter. And this is also a good idea. We're actually asking York University or other community partners, because it's we have social media, and this way we kind of supporting each other. And this is becoming more and more faster and more efficient way of finding specific information and promoting information you want to promote. So please, 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 all regions, whoever can, go to Twitter and promote those infographics. And if you like it, oh, wonderful. So it will, it will be just, yeah, very helpful for everybody.
Thank you. Marina, another question from our audience. I noticed that many public washrooms in Toronto and at York have switched from paper towels to hand blowing dryers. Do you think we should be going back to paper towels? Many people use paper towels at touch points, such as turning off the taps or opening the doors.
Uh, Luckily, I haven't been in public washrooms too often, so it didn't even drag my attention that it's been switched. As far as I remember, I saw paper towels, and I do like paper towels. The only rationale behind this, I may only guess, would be that people would be not disposing the paper towels properly. This would be a concern because if you wipe your taps, if you dried your hands, and if a person is infected and they did not dispose it properly, then it's a hazard. Then it's becoming a risk for spreading infection. In this sense, dryer would be much safer in terms of it dries with the hot air and dries hands. If you're able to, because yes, you're right, I would agree that turning the tap on with not touching your hands would be preferable and felt safer. Just we need then to make sure that everybody disposes those pieces of paper properly. So that's to answer your question. But again, it should be in the protocol, safety protocol, or IPAC procedures of York University, or any specific organization should specify it, how they want to deal with this issue.
Thank you. Rena, one of your slides earlier in your presentation mentioned how students in grades 4 through 12 should wear a mask. One of our audience is interested in whether or not the mask requirements are now for all grades except kindergarten.
I believe so, yes, yes. Yes,
They are.
because the only exemption, as I said, we mentioned exemptions, right? So as per the exemptions, it's only there are certain categories like special needs which cannot possibly wear a mask. So, but this is addressed individually and differently. But wearing a
Excellent.
mask, and actually parents, there is in this resource guide for parents, which I pointed you, like resources for parents under the reopening. Please, for all the parents, I really recommend you to go and to look all the resources which they provide there. They address many more questions than this on the parents, even how, because children are required to supply several masks, for example, right? So how they should pack their mask. It's specified they need to provide a bag for the clean mask, which should be paper bag, for example, and a bag, plastic bag for the used mask. And there's a difference. These are like details like this, because a clean mask is better contained in a paper bag, so it does not become moist, so it's become breathable. It contains its properties, for example. But there are much more details on not only on mask in these parents' resources on the website.
Thank you, Marina. We're just about at time. I'm going to take one last question from our audience. Will the City of Toronto do contact tracing if there is a case at York University, or is it up to York University to do the contact tracing? I understand that Toronto Public Health has paused contact tracing in certain situations due to the large amount of contacts from positive cases.
Because we're very short on time, I see. I'll try to answer this briefly. Unfortunately, Toronto Public Health had to discontinue contact tracing on a general level because of the load of cases, and we're just trying to allocate resources more efficiently. But in the high-risk context, contact tracing is still in place, meaning, and there is a procedure which I mentioned is later specified in the guidance, how York University or how any university should notify Toronto Public Health of a case. It's different for if the student lives in a dormitory or if they live outside of campus. It's different procedures. When notifying, they also should notify us if it's a high risk context. That's kind of questions they need to answer when they submit this information. And depending if this is a high risk context, then the contacts will be contacted by public health. If this is a regular low risk context, then it will be up to the people who get tested positive. Actually, this will be their common due diligence to notify the people they've been in contact, or the York University will notify. But as I said, high risk contacts are still TPH are being involved.
Excellent. Thank you, Marina. And we are at time. I'd like to thank you for joining us today. Your presentation was very informative and our community appreciates your time. I would also like to thank the audience for joining the conversation today and for all of those behind the scenes who made this session possible. I would like to close our session today by reminding you to visit York's Better Together website, which includes information on COVID-19, the university's protocols and practices, and resources for your health, safety, and well-being, and a reminder to visit the City of Toronto's COVID-19 website for the most up-to-date information about COVID-19 in our communities. The recording of this session will be posted on the Better Together website and will be available for the next 7 days. Take care, everyone, and please keep yourselves and each other safe.